let's give all three of you an opportunity if there is something which triggered a thought for you as either of you were speaking to respond to. And one which I thought we could start with, when we started the webinar, we asked participants how they were feeling, and it's clear that there's a mix of there's some hope, there is some, I'm not really sure if we're going to do anything different. And I think you've all made the case that we cannot go back. And what I'm also hearing as an undercurrent is for us to not go back, then we have to think about ways to hold ourselves accountable, our systems accountable, and our governments accountable. So I'd just like to invite you as you respond to each other to think, to just give us a sense of what kind of structures and processes do we need to be contemplating right now as we think about this idea of recovery. And maybe we'll get started with Trish.
Hi. All of a sudden it's like, oh my gosh, how do I unmute myself? Well, first of all, I just, Camille, Louis, you just bring so much depth to this conversation, and are really, bringing forward the real struggles that will be involved in changing the system. And I love that everyone's problematizing normal or new normal. Somewhere once I read that normal is a setting on a dryer. There was nothing normal about how the old system was working, especially since it just compounded and ignored inequities. I really think that we're in a moment where the old system is dying, and we're at, Gramsci talked about when you're in the interregnum, sort of the in-between, and there will be a lot of discomfort. And I agree with Louis that there will be a power struggle. And there are people who aren't comfortable with the discomfort that we're all feeling in a moment where there's so many unknowns. And I think that it's up to all of us to help work through that, to understand that people will be at different phases of thinking and different abilities to start imagining a different future. And I think that we have to put forward that vision for people to see the new system. If the old system is dying, let's show them what the new system could look like and how much better it could be.
So it's Camille. So here's, again, language becomes really important, and Canadians have a lovely way of quoting things and not looking at it head on. And I really do think the Indigenous community have been at this place several times, and not speaking for the Indigenous community, just observing, and then, it's a come to Jesus, come to whoever it is moment, and then 5 years later we're back in the same place. We had the emancipation of slavery, and then right after that we got Jim Crow, and we still have that today. So all of us need to really be able to articulate what has really happened, and be able to hold ourselves, and not just government, but our bosses, our jobs, accountable to say, if we do this, this is what we're doing. So it needs to come to the forefront of consciousness for people. And I think when we say, let's prioritize something, then we have lovely language. What we don't say is, okay, what does this actually mean and for whom? So that we consciously know when we put this at the bottom of the priority, then we know that's what we're doing.
Thanks for that, Camille. I think you're talking about this come to Jesus moment, and it definitely echoes some of my own experience. Trish, you talked about us being in this in-between and the need for for just being, in a sense, being okay with what we do not know. And some of the work we've done at the Center looks at health equity leadership and what it takes. And that is one of the things we hear fairly consistently, that to do this work to advance issues of health and social equity, there's really a need to, in a sense, embrace that ambiguity, the discomfort, and not let that be a barrier to action, but acknowledge it and move, in a sense, move through it. Louis, Camille just introduced this idea that we, in many ways, have been here before. So as an Indigenous person who is grappling with issues of health and health equity and reconciliation, what are your thoughts on that? And what do you think this all means for current conversations around reconciliation? Okay, Louis, I'm not sure if you're still there. You may need to unmute yourself, and it is #6.
Is that better?
Hi.
Yes.
Okay. I was just saying that in its nature, in its DNA, and in its history, Canada has patterned behavior when it comes to addressing issues: public health, social, racial, historical. And the solution is often based in bureaucracy. And moving forward, has become a bureaucratic exercise, and that will not lead to any resolution or any transformation. I do think that this is an opportunity to transform, not to adapt. We will have to adapt, but it's also an opportunity to transform as a society, and a society that is equal to everyone. And so, as an Indigenous person, we have tried. We will continue to, as a society, as a founding society, and an ancestral society, we will continue to be generous. I am cautious around the authentic generosity, rather than that might be difficult to solicit. We see it now where everyone wants to be a nonprofit organization, rather than supporting those in the trenches and those in the field, where everybody needs their moment, celebrity through charity. And so, but moving forward, I don't think the organizations will get the resources. It will still need to be competition. I was involved in trying to address suicide with Indigenous communities at the national level 40 years ago, and these issues have not changed. And so, because we are in our nature, Canada it's in our treaties with Canada, with the Queen, whereby we avoid conflict through bureaucracy, and so that's a 100-year process. So we need to reconcile. We have this opportunity to reconcile something bigger than Indigenous relations and Indigenous rights in this country. We have an opportunity to reconcile. It's a tall order to reconcile our relationship and our sense of belonging and our role and purpose in all of this. So it is an opportunity. It's a difficult one. I was involved with an organization while traveling who was actually promoting more gated communities as a response to COVID, whereby let's look at how do we put walls to keep others outside and to keep those who are well on the inside of the wall well furnished with what they need so that they can actually, and this is already in place in some countries, and I suspect that this will also be of interest in Canada, whereby it will be an us-them, outside, inside, we're well and others are not to be trusted. So that's the pattern of privilege, and that's been well established. So how do we do the courageous work to actually challenge some of this ideology that's going to resurrect itself, and it's going to come back in a worse way than the virus ever did.
Thank you for that, Louis. And some of your comments are really resonating here with participants. Someone just pointed out we avoid conflict through bureaucracy. Hit hard, but such an important point. So thank you for raising those. Again, just to affirm what you're all saying is we keep hearing about this idea of courage, right? As we try and tackle some really persistent social problems. We have some questions from participants, so we're going to continue taking the questions as they come in. This question has to do with how we align what's happened in Canada and Turtle Island with some global movements, particularly around sustainable development goals. So the comment and question is, we may benefit from positioning this, connecting to this work we may benefit from positioning this work to work related to the Sustainable Development Goals, which aspire for a more equitable and sustainable future. Do either of our speakers care to comment on that? So will we get further ahead if we link our current conversations to the Sustainable Development Goals?
Go ahead.
We'll get us started.
Go ahead, Louis.
I'll start. I think this is a very interesting idea. This is an opportunity to not be issue-specific anymore about what we prioritize or what's important as far as an agenda, but as a way, it's an opportunity to harmonize, but also to look deeper at to what the real profound fundamental issues are that is causing this division and disharmony. Because you can conquer through division, you can conquer through difference, you can conquer by prioritizing one at the same time, deprioritizing another, because that's just our nature. And so I think the Sustainable Development Goals are essential, but we have to redefine what sustainability means. Is it in the same paradigm or in the same economic model or in the same developmental model? That so therefore it could be just propaganda to pursue more consumerism or to project onto others what we define as in a very biased way culturally as what sustainability is.
So on the surface, I would agree with that, but just below that, been through too many of these, and sustainable for whom is my first question. So when I see large movements like this, I can agree with them and all of that, but once you get underneath, it's like the women's movement. You know, as an avid thing of the women's movement, then quickly realize, oh, okay, I'm not included in that movement. Women of color is really not included in this so-called women's movement. And we've seen that consistently. So can't disagree with it, but I would like to see the definition and the work and who are we talking, you know, who will benefit at the end of this sustainable movement. And that's where I'm just a little bit cynical over the years. So that's the difficulty there. I agree, but it's for whom. It's like I agree with a lot of people who do green. Cannot disagree with it in any way, shape, or form. But I also look at the same folks who do green as how they do anti-racism. And so it's hard for me to get in there when they themselves trying to do good work have not dealt with some of these other things that are exclusionary, if that makes sense. So there's a core piece around equity. There's the anti-black racism, the indigenous racism. If we don't really articulate those and make sure they're included in all this other work, we end up with improvement and widening inequities.
Right, thanks for that comment, Camille. And I think you're really making the point of us having really nuanced approaches as we, regardless of what particular issue we are trying to address. And I think the comments you're making really, like, they show up in a whole host of particular determinants of how which we try and address. I want to take us to this idea of what we need, right? What do we need in terms of structures, in terms of messages, and in terms of action going forward. I think it's clear that we do have this, window of opportunity, political window, where a lot of things which may not have been possible, a lot of conversations which may have appeared maybe fringe, are now a bit more visible. And so folks who study social movements talk about really the importance of having political opportunities, mobilizing structures, and resonant frames or really effective messages. So if you were to think about some of those effective messages which we need to continue with this conversation, I'm going to start with you, Trish, because you mentioned your work is really around nudging public opinion and government action. What are some of those messages which you are carrying through in your work, which actually compel people and move us to action?
Well, one of the things that I have been noting as this pandemic and the reality of it really starts to sink in is, and I noticed someone posted earlier in the chat box about Overton's window and how the Overton's window is really shifting. And the Overton's window is really is a basic theory that describes ideas that were once sort of on the fringe, considered radical, can over time, and sometimes it can happen quite swiftly if there's enough of a shock to the system, that those ideas can go from the fringes into the mainstream. And so, I think we're starting to see that with even the basic income. Like 5 years ago, very few people were talking about the basic income. And then, a couple of years ago, Ontario did a pilot project which was showing that it actually was having a positive impact on people's lives, on their health, on their mental health, on their hope and optimism for their life chances. And then all of a sudden, COVID-19 comes along, and it becomes painfully obvious that what we knew before the pandemic, but painfully obvious that the employment insurance system was not up to the task. And so the federal government created policy magically almost overnight, like it really quickly in an unprecedented way, and created the community emergency response benefit, which is not perfect, and a lot of people are getting left behind, and those people who are getting left behind were already getting left behind because of inequities pre-pandemic. But I do think this is a moment where people are sort of looking at the car and kicking the tires in a new way. Basic income is one example. I recently just saw a poll, an Angus Reid poll, that showed the majority of Canadians say that governments should take into account public health before the economy right now as they decide how to reemerge from COVID, et cetera. And that, to me, is another Overton's window shift, that we're starting to recenter public health. And those are the sort of clues that I look to that give me hope. And I understand, reasons for not feeling hopeful or pessimistic as well. But I'm always looking for those signs of what's shifting. And I think this is changing us in some fundamental way, or at least I'm hoping so.
Let's go with Camille and then Louis.
So there two things there. I think, yes, we're seeing some emergence of some ideas and some issues. So let me just talk about race-based data. We have been pushing race-based data in Toronto for a long time. And so even though I agree with Trish that I hope public health comes forward, I struggle with the fact that things like, we all say we're evidence-based, we all want evidence, and yet consistently as I look across this country, equity data is not the underpinning of our public health system or our research system. Yet we talk that everything we do is in evidence. So you have to ask the question, why is that not happening? Why is there such resistance? And there is really strong resistance to collecting this information. So as public health moves back into the forefront where it belongs, I'm just a little bit skeptical if they also do not embrace the notion of equity data being collected. And equity data for me, it goes beyond race-based data. Race-based data is important, and I'm committed to that. But I also look across this country and I see a lot of poor white people suffering and struggling, and they're ignored as well. So the equity data about income and all that is important. So I think we see that coming out of the U.S., we see that coming out of England, we see the mayor of England shouting for race-based data, because I think that is key to decision making and should inform policy and should inform funding going forward. So there's a movement afoot. And so for me, the question is, how do all of us in our jobs, all of you in your jobs, all of you as you do your work, how do you continue to do work around equity and advance it without the basic information of equity data? And I think that's something that needs to catch on and move forward. It is the underpinning of the next iteration of whatever we create. If we create it without that, then I think we haven't really moved forward.
Great. Thanks for that, Camille. And I just want to note that in terms of opportunities, right, there's been quite a big momentum in the Ontario context, and we've started to see a number of public health units say they are going to be collecting equity and race-based data. And from the work we do at NCCDH, we know that a lot of those organizations had the foundations in place already. So in this moment, we're able to draw on that. So I just want to echo that work is continuing to happen. It needs to happen a lot better than it currently does. And our team here at NCCDH is here to support organizations actually trying to grapple with what to collect, how to collect, and most importantly, how to use that to drive action. We have a question which I'm going to put out there and invite, Louis, we'll start with you, and then we'll go to Trish. The question is, what is the role of political theory in assessing social justice premium of different strategies? So, for example, some argue that growing consensus around the value of basic universal income is because global capital needs populations to have money to spend.
That's a really complex question. Many dimensions to it. I think many theories in it as well. And I'm not well versed in all of them. I do think that politics, for the most part, have a tendency and a tradition to sustain the status quo. That's just one of the cornerstones of the social structures that we have. They're not always, they're very rarely actually designed for sustainable transformative change. Again, it's just the traditions of the societies, and they mostly serve the economic interests, which are an elite interest, not the interest of those in the margin. So it's always a tension between those with privilege and power and those without. And so, I think this is an opportunity. If we're going to actually transform rather than just take a slow boat to change, we have to make public health a human rights issue that is undisputable. Because one of the things that COVID has done moving forward is that we are conscious now on some of these realities and how we've been impacted by it. It's not a traumatic issue, it's a consciousness issue. And so in the past, in my history, in my involvement, ignorance is always the explanation for becoming aware. I wasn't aware, and ignorance is seen as an innocence when in fact, if you drill a little bit deeper at the organizational, at the structural, at the individual level, at the power level, behind someone's lack of responsibility or accountability is that they were ignorant of the issue or they weren't aware. And that is a pathway to action that is full of pitfalls. And this opportunity that we have now is that we are conscious, and that's painful, and that can be very challenged. But our responsibility in public health is to sustain consciousness, not to go find more evidence for something that we're already conscious of. We have to find. I've always trumpeted. I've always raised the issue that and I've worked in statistics. I worked at leadership in healthcare for many, many years in public health and systems level. There is a reason why we don't have equity-based data. It's because it would raise our conscious. It would bring to us to terms with regards to why we are accountable for not doing something about our consciousness. And the structures that we are in know what they're doing. It's strategic. And so they'd like to work at the fringes, but keep those who are in the fringe at the margins where they are, because they don't want to disturb the power. So there are going to be some challenges here, but the political will to sustain the change, I don't think is to be counted on.
I agree with you, but I do think that this is where we need the public, and several of us who work in the system have been co-opted by the system, and this is an opportunity for us now. We still need our jobs, we still need to pay our rent and our mortgages, but there are ways in which we ourselves need to begin to articulate some of this in our jobs as we get the pushback. I use the word culling deliberately because I think it is as deliberate as that, even though we may not be calling it that. I do agree we refuse to collect race-based data and equity data because we don't want to be held accountable. But it's time for those of us in the system to even be saying to our bosses and our organizations, it's not okay. We cannot be in public health and not want to be held accountable for these very people that we're paid good salaries to talk about. So, we are also benefiting on the back of inequity, myself included. And so, it has paid me well, allowed me to retire well. It's time now to acknowledge that and say we now must really make some significant changes for those folks. And we can't do it without the data, because we're all based on talking about we want informed information on everything we do, and then we deliberately don't collect the information.
Thank you
that,
so
Camille.
much.
I truly agree with
Thank
you,
you so much, Camille, Louis, and Trish. I know we can continue this conversation, and I just want to acknowledge that we are at 2 p.m. I'd like to thank the three of you for joining us and for really offering some really thought-provoking ways for us to go forward. And I think you're all calling on us to, from wherever we find ourselves, like to do what we can and to recognize the roles we are all playing in maintaining the system, because I would agree, I don't think any of us is innocent in this, and this really speaks to the importance of us to all act in different and bold ways where we find ourselves, and to not, in many ways, to not say, not accept no, because we will get no for a lot of the things which we do propose, but to stay and actively challenge, really challenge power, because this is what this is ultimately about, shifting where power lies in society and shifting how resources are distributed. So I'd like to thank you all three, Camille, Trish, and Louis, for joining us today, and to all the amazing participants who have been with us today and throughout the conversation series. Thank you all so much.
Thank you.